Die maatreëls en planne wat die president Sondagnag aangekondig het om die uitbreking te probeer bekamp is wyd geloof en tog wonder mens. Het ons gesondheidsdepartement en hospitale die kennis en kapasiteit om hierdie maatreëls na te kom. Ek gesels nou met die DA-LP Siviwe Gwarube. Sy is in beheer van die amptelike opposisie se gesondheidsportefeulje. Siviwe, welcome. What worries you most about government's plans to combat the corona pandemic?
Good evening, Valdemar. Our biggest concern at the moment is the capacity of the health department and the health sector in general in South Africa in dealing with, particularly now that there are local transmissions in the country. We now are knowing that there are 116 cases with about 8 local transmissions, and our concern is that contact tracing of local transmissions is near impossible, and it is quite difficult. And we're also aware that the people who, for instance, need to isolate or who need to be quarantined not all South Africans are able to self-quarantine at home. And so we're going to need to have capacity built or facilities made available for those purposes as the cases grow larger.
Okay, so what are you suggesting then? Because the shortcomings that you've explained, we know that they exist. That's not going to be solved in the short term. What are you suggesting should be done in the short term?
3 things. We believe that firstly, we're calling, and that's what we have done yesterday. We have called on the private sector and particularly the big hospital groups, to come on board with availing some capacity and some resources to the department as needed. We note that some of them have already come on board, and they've said that they may be able to provide beds, extra ICU and isolation facilities. And so it will be important that we treat this obviously as a national crisis and we get everyone on board. Secondly, the availability and the improvement or refurbishment of military hospitals. In this country, we don't often speak about the military health services, but they are there and they are available. And so it's important that the Minister of Health and the Minister of Defense are in conversation about that. And lastly, I mean, if things do get to a point, Valdemar, where we have to treat people on mass scales, then it's going to be important, in accordance to the regulations that were released this evening, that the Minister of Public Works starts to identify facilities where people could be treated, and those facilities could be made into makeshift health facilities.
Siviwe, tell us why, a member of the public who is a little bit skeptical about government capacity for good reason, because the DA has been telling us with good evidence for years that government is not up to the task. Tell us why a skeptical member of the public should be worried, because the numbers are still quite low. We have about 116 officially documented cases at the moment. What can that plausibly become in the next 2 or 3 weeks?
The concern here, I mean, obviously South Africans must, by all means, try not to panic. But the concern really is this, that up until about 3 days ago, we were seeing that most of the infections were people who have traveled into the country. And as a result, it was always much easier to trace the people that they've been in contact with. So be it an Uber driver, be it, people at the hotel or at the Airbnb or whatever the case may be. But now that we've got local transmissions, the reality is that it's much more difficult to trace people who have been in contact with somebody who may be infected. And so you may have somebody who works at your house and who goes back home and gets into a public transport and is in contact with various people. So that's the concern at the moment, and that's the worry, that with local transmissions, to contain and trace people, it's going to be very difficult. Then the second thing is testing. The capacity of the NICD is not such that we can roll out mass testing. And as we have seen earlier this week, the World Health Organization has emphasized testing is the way in which we're going to mitigate the spread of the virus. But we are experiencing some shortages with testing kits. And also there is obviously limited capacity as to what the NICD can do at any given time, even with the onboarding of private laboratories coming on board, such as, and also the NHLS.
Right. Siviwe, so Italy went from 100 or so cases, such as we have now, to 30,000 cases in less than 3 weeks. Is there any reasons why our viewers should expect us to perform better than Italy, given the state of our public hospitals?
So one of the things that has been commendable, Waldemar, at least from the South African government, is that we have essentially implemented some heavy-handed interventions as of Sunday. The declaration of the national disaster means that there are funds that will maybe be made available to provinces to combat this, the spread of this virus. We think that there will probably be a special appropriation bill that will need to come to Parliament to release further funds into this. And also there are some really, the travel bans will go a long way into being able to essentially assist South Africa with managing the inflow. And also the banning of gatherings will also go a long way. So I think that there are some commendable steps that the South African government, the president in particular, has announced that are heavy-handed enough. And we know that from international best practice that if we try and flatten the curve, which means if we try and implement heavy-handed interventions early on, it's much easier for the country to then recover and then contain further infections.
And very quickly, we did these drastic things long before the US and Italy did them.
Yes.
Siviwe, thank you. That's all we have time for tonight. Thank you very, very much. Wat gaan die virus se uitwerking wees op globalisme, 'n ideologie wat reeds die afgelope dekade erg onderskoot is? Ek vra die vraag aan twee gaste in die volgende segment van die program. Bly ingeskakel.